Hello, gorgeous. You are watching straight from the doctor's desk with me, Dr. Andrea Purcell, where we specialize in menopause medicine and help women struggling with health and hormonal issues reclaim and regain your life using natural medicine. Ultimately, it's all about you, so you can stop surviving, start thriving, and get back to that quality of life that you love. Today, we are talking about thyroid medication. If you missed my post on thyroid testing, go back and watch that because it's important to determine through testing what your thyroid is actually doing and if you are a candidate for thyroid medication or hormone replacement. Thyroid medication comes in two main categories. And really what we're talking about here is some type of thyroid hormone. Comes in natural and synthetic. Natural refers to natural desiccated thyroid or NDT. NDT is a medication made from pig thyroid tissue. It's freeze-dried, it's powdered, and then it's made into tablets. Pig thyroid glands produce the same hormones as in humans' glands. The natural thyroid in pig glands contain three active hormones, T4, T3, and T2. When we take synthetic thyroid hormone made in laboratories, it contains either T4 or T3. Natural thyroid medications are readily available, they are well standardized, and they are effective. In conventional medicine, nearly everyone prescribed thyroid hormone receives a T4 only medication called Synthroid or levothyroxine. However, in many cases, women feel better if they also receive T3 along with the T4. And with those synthetic hormones, you really would then be prescribed two pills, one for T3 and another for T4. There is no way to include T2 with the synthetic hormones. The rate of absorption can be a little sporadic when dosing them separately, but generally works well. With the natural desiccated thyroid, it contains hormones bound up in carrier proteins, and that makes them slower to absorb and allows them to create more steady blood levels. So if someone is on synthetic thyroid and wishes to change over, it does require working with a doctor who's familiar with the use of natural thyroid and knows how to convert someone. There is a small portion of people who do better on T4 only medication, yet the vast majority of women can do equally well or way better on natural thyroid. For years, endocrinologists argued that natural treatments for thyroid were too difficult to stabilize the levels. This includes NDT combinations, also known as Armour thyroid and NP thyroid. However, in a study done in California by Kaiser Permanente, large numbers of patients on thyroid treatments were monitored for several years. One group was on NDT, natural thyroid, and the other was on a synthetic, just T4. The researchers found that those on the natural treatment had no harder time stabilizing their levels than those on the synthetics. So that can put that argument to bed. So the study confirmed that NDT thyroid medications are readily available, they're well standardized, and they are effective and deliver steady levels. And as I said earlier, for many women, NDT can and does work better than synthetic thyroid medication. If you're wondering about the success rate of using natural medicine in thyroid disease, I'm just going to share a patient's story with you. Daniella came to see me with an under-functioning thyroid. Her MD wanted to put her on Synthroid, and she just decided to come to me for a second opinion. She just shared that personally, she had seen her mom go through cancer treatment, and she was really against going on any synthetic medication long-term for life. And, what I said to her is, hey, we can determine if you truly need thyroid hormone replacement or if we can get your body to heal on its own. So we ran her labs. We discovered that she had autoimmune thyroid and that her antibodies were very high. And I started specific supplementation, lifestyle changes, dietary changes, and then we retested her thyroid again in a few months. Her antibodies had dropped and her thyroid hormone production was up. So she was excited because we were headed in the right direction. She continued with the changes. We were making small tweaks and just really made them a part of her daily life. And then 6 months later, we retested her thyroid and all of her numbers had normalized. She was honestly amazed and so overjoyed. And then she said, although making changes was hard at first, I feel better than ever. And I can feel that my body is functioning better than it ever has. So thyroid disease can be treated naturally, utilizing diet, lifestyle changes, specific supplementation, and proper thyroid hormone replacement if warranted. For those who need to remain on medication, natural medications such as NDT or compounded thyroid can be used effectively, safely, and get you those quality of life symptoms that maybe you're missing. So for every thyroid patient, diet therapy along with specific supplementation, trace minerals and things such as iron, selenium, or iodine can significantly improve thyroid function and reduce the amount of thyroid medication that's needed. So if you're sitting here and you're feeling frustrated, fatigued, foggy, and frumpy, there could be something going on with your thyroid. So it's time to get a fresh look and take a different approach to your health. All you have to do is reach out and ask for help. You can get answers and you can make changes now that set you up for more energy, a clear mind, weight loss, and more. So if you like this post, let's hang out some more because you become who you hang around. Just subscribe here and you won't miss any of the info. You can also check me out on the web at www.drandreapurcell.com. I hope you found this informative.